During gynecomastia, we leave a little bit of breast tissue under the areola so that the areola doesn't sink in. This means that we leave behind what we leave behind is as important as what we take out. So for that reason, gland can grow back because we've left behind a little bit of tissue to support the areola. Otherwise, you get donut deformity, which is unsightly, and some patients, don't like that. Some patients can get away with removing the whole gland, and that's another question. For some cases, if you have thick skin, you have well-built muscles, probably yes, we can remove that. But this, as I said, is a judgment during surgery for best outcomes. If gynecomastia is not caused by sinister causes, or there's no treatable condition, or you're not bothered by it, then you do not need surgery. But we can help you if this is bothering you by removing the gland or any tissue that is causing the gynecomastia look. Depending on what type of gynecomastia surgery you're having done, it usually takes about 1 or 2 hours, depending on whether you're having skin excision, VASER liposuction, or skin tightening. And because we're using local anesthetic, the procedure is quite bearable. For most patients, the worst part of the procedure is just when we're injecting the local anesthetic. That is the needle prick, the stinging. But once it's numb, we're able to do the surgery, and we're able to keep the patients comfortable and chat with them. After the procedure, most patients only need paracetamol, usually for the first 2 days. The way we treat gynecomastia depends on what you're presenting with or what grade your gynecomastia is. It ranges from puffy nipples to large pendulous breasts with excess skin. That means that the treatment can just mean removal of gland or just liposuction if it's caused by fat, or both, which is more common in our practice. So removal of gland, tissue, and liposuction for contouring. Sometimes that's all you need. Some patients need debulking when there's a lot of fat involved, and chest contouring. If the skin is not taut or it's slightly loose, skin tightening modality like body tight or J-plasma may be a worthwhile approach. Or if the skin excess is severe, then skin excision is an option. My approach is to do these procedures using local anesthesia, meaning that patients are awake, because I feel it's safer in my hands and more efficient. So it's quicker for patients. They don't have to stay in after surgery, and they don't have the downtime that they get with the general anesthetic. And also somehow patients participate in the treatment. They're aware of what's happening. They can communicate. They know exactly what's going on during the surgery.